Each day of the 7th International AIDS Society Conference on HIV pathogenesis, treatment, and prevention in Kuala Lumpur, Malaysia, we'll be talking with Dr. Karl Diefenbach from the National Institutes of Health. Here are the highlights from Day 3.
Dr. Diefenbach, thanks for joining us again from the International AIDS Conference in Malaysia. As you have done in the past few days, could you share some highlights from today?
Sure, Miguel. There were two key highlights from today that I'd like to talk about. First were sessions dealing with social determinants of health, and the second was a session we held on the future directions in HIV vaccine research. As we think about social determinants of health, it is basically the social capital that is developed in society and by individuals that promotes good health, or in the case of societies that do not promote good health, what they are doing in a way that promotes stigma, criminalization, and marginalization of key affected populations. There was a lot of data presented on the importance of making sure that everything that is done to essentially promote good health-seeking behaviors, to move toward providing the kinds of access that's required to deal with the challenging components of human life. If you have an injecting drug-using population, the best thing you can do that seems to occur worldwide is provide substitution therapy as well as clean needles, because the combination of the two plus a supportive healthcare environment allows people to get control of their lives and move forward as productive members of society. So this is an important area, and particularly in this part of the world where a significant number of the epidemics are driven by injection drug use. As we move forward and think about how that impacts the epidemic in the United States, throughout the United States, we've done actually a pretty good job of reducing the number of transmissions due to injection drug use. But the major message out for social determinants in the United States is how we can promote the behaviors that reduce stigma, that promote inclusiveness, and bring marginalized, target, at-risk populations into prevention, and people who have become infected with HIV into a supportive care environment where they can receive the treatment that they so deserve. The other, in a completely different arena then, we had a really good session today on the future in HIV vaccines. And we had the leaders in the field come in and talk about the really exciting work that's being done on follow-up of the RV144 trial, the Thai trial, which is interesting because that also was done in Asia. And we had the leadership of the Thai organization that ran that study with the U.S. military HIV research program and the NIH come in and talk about next steps. We had Dennis Burton from Scripps Institute come in and talk about his work on the development of broad neutralizing antibodies. And then we had a really good panel talk about the challenges of what it will take to get a safe, effective, and durable HIV vaccine. It was one of the more packed sessions at the meeting.
Why, thank you, sir. And when we talk about these two topics, what do you see as sort of the message we want to share with our AIDS service providers across the United States?
So it comes, I think the lesson over and over again is that whenever you can, in your work, in your starting with your community, with your neighborhood, your precinct, your census tract, all the way up, the more you can do to promote the appropriate behaviors that reduce stigma, that create inclusiveness in the society for access to care, so you can promote health-seeking behaviors and reward that kind of behavior, often in a structural way, but oftentimes it could be just at an individual doctor office to doctor office approach. You will have a better outcome in the AIDS epidemic. So it all comes down to treating people as people and honoring them as citizens of the world.
Well, sir, thank you. This is Miguel Gomez with AIDS.gov.
For more information on the conference, visit www.ias2013.org. And for For more information about federal HIV programs, visit AIDS.gov.